Taking care of business on Saturday mornings on WHP 580. I'm Michael Parks. And again, thank you very much for starting off your weekend with us here on WHP 580. We are taking care of business, and these folks have been with us from the start as we started taking care of our local businesses, spotlighting them, showcasing them. And they are the perfect example of the businesses that we love to promote and love to hear about. A family-owned business started by a family, a husband and a wife, grew just incredibly, and then eventually became an employee-owned company, and now continues to strive and thrive and do so many things for us here in Central Pennsylvania. They are the folks with CPRS Physical Therapy, and joining us today is our good friend Francesca Kirk. Francesca, good to see you again.
Good to see you too.
All right. For the folks who are tuning in, a lot of folks, let's talk a little bit first of all. I just teased a little bit about CPRS. So just tell us a little bit about CPRS.
Sure. CPRS, we started in 1983. So this year is very exciting for us because we are celebrating 30 years in business, which is pretty great to have these days. We started in Millersburg. That's where our corporate office is. And we've grown to 26 locations throughout Central PA. Something else about CPRS is we are employee owned. So that's a little bit different that you'll experience at our locations. All of our therapists, from clerical staff to physical therapist assistants, aides, the physical therapist, everyone is 100% vested into our patients and into the business. And we like to promote that we can see patients 24, 48 hours to get them in quickly and provide that quality patient care. And
from all the years that I've been talking with you and meeting the staff and talking with the patients, it's, these people are the best of the best. They hire the best of the best. Their staff is just incredibly talented in all that they do. When you think of a physical therapist, you think of somebody who's, they're going to help you if you hurt your hand on the job. They also provide for area sports teams to take care of them. And today we're going to tie in something that I didn't know that they do, but we're going to find out more about it. And it's very, very time appropriate since we are in the middle of October, which is Breast Cancer Awareness Month. And today we're going to talk about cancer, breast cancer, and what work is being done and what help is being offered by CPRS to provide people who are suffering from cancer, how physical therapy can play a very, very important role in the recovery from breast cancer and cancer. So let's, why don't you introduce our guest for today?
Sure. Today we have Karen Gallo. She is a physical therapist with CPRS. She is at the Heart of Lancaster Regional Medical Center. And we have Melanie Rice. She is at the Lancaster Hematology Oncology practice in Lancaster as well. And so as of April 1st, CPRS partnered with the Heart of Lancaster Regional Medical Center in Lidditz, and we are managing inpatient, outpatient therapy. And so it has been a really great experience for us. It's a new venture, but we got to have all these new people, a part of our staff from the Heart of Lancaster. And a part of that, we get to reach out and to groups like the Lancaster Hematology Oncology group and start different programs such as this oncology therapy program that we're working on right now. And so that's what's really exciting for us. We are seeing a population that is in need of therapy, and we are reaching out to this group in particular and some other groups in the area and working with Karen on how to provide better care for these patients suffering with cancer.
Now, Karen, let's talk to you first of all. Let's talk about the importance of how this comes into play. As I mentioned, it's Breast Cancer Awareness Month, but it's not just the women who are suffering and recovering from breast cancer. It's any kind of cancer. Tell us about the importance of how physical therapy plays a role in that kind of healing.
Sure. Cancer patients and cancer survivors can experience many different types of treatment effects, from surgery, radiation, chemotherapy. And I think in the past, there was such a focus on really surviving cancer that those treatment effects were maybe not paid attention to quite as carefully. So we hope to kind of bring that into the spotlight and know that there is something that you can do about cancer-related fatigue, problems with your mobility, moving around, problems with your activities of daily living, being able to just take care of yourself. Also lymphedema, which is more prevalent with breast cancer patients.
I would think, too, and knowing myself and the people that I've met at CPRS who have gone through physical therapy, not only is it the physical part of the therapy, but it's the mental aspect, too, because, you're going through a very, very incredibly trying and tough time. I would not even begin to understand, what people go through, especially women go through when they go through chemotherapy and through breast cancer recovery. But there has to be a mental aspect too, is, if you're physically happy, then you're mentally happy.
Absolutely. There is even some studies out there that show that patients who can increase their activity and kind of fight that cancer-related fatigue that happens can complete their treatment more timely and really have the energy to get through that treatment.
Now, I would assume too, this all seems new to me. It may not be new to a lot of people, but maybe a lot of our listeners are not aware this is out there. Is that true?
I would think so. Like I said, I think a lot of the treatment effects are expected and expected by the oncologist and given to the patients that this may happen to you. But I think there's probably not an awareness that maybe I can do something about it to either combat those treatment effects or maybe prevent them from starting altogether.
Yeah. Also joining us is Melanie Rice. Melanie is a nurse practitioner at the Lancaster Hematology Oncology Center. Melanie, tell us a little bit about the center itself, what you do and all the many people that you help.
Sure. We are a 3-physician practice, and myself, a nurse practitioner, and we see patients in the office who have cancer and who have hematologic disorders. We have 5 oncology certified nurses in our office who administer chemotherapy, and we do infusions in the office. And we meet patients who come in when they're first diagnosed with cancer. We follow them along through their journey of getting treatment, whether that's surgery, radiation, or chemotherapy, and we continue to follow them throughout the rest of their life.
Well, again, with you too, the center is how old?
8 years.
About 8 years. Okay, so a lot of people, and basically that is your specialty. So
yeah.
You are also, if people come to where CPRS is tied together with the Heart of Lancaster, you get a lot of referral patients. So this is your specialty. So in other words, if you are, God forbid, diagnosed with cancer, then they come to you because that is your role in all this, correct?
Yes.
Is it from the beginning to the end, from the when you're diagnosed with it? How far do you go?
Sure. We begin care right at the diagnosis. We do get referrals from patients' family doctors if something is found abnormal. We often get referrals from surgeons. Maybe people have had surgery and the outcome is different than what they would have liked. Surgeons will refer to us. So we get referrals in a number of different ways.
All right, let's talk. Let's do Medicine 101. Oncology. Oncology is the study of cancer?
Yes.
Okay. Hematology, blood?
Blood disorders, yes.
Okay, blood disorders like just a number.
Anemia, things like that. Thrombocytopenia, low platelet counts, low blood counts, things like that.
Total different thing from cancer?
Yes.
Okay. But there are a lot of people who are suffering these things. And again, this is your specialty. This is where you help out these people with these areas.
Yes.
Okay. When it comes to breast cancer, one of the things that, Karen, a certified lymphedema therapist, tell us about, again, let's go back to Medicine 101, lymph nodes and lymphedema. How does that play in the role when it's diagnosed with breast cancer?
Sure. So women who are diagnosed with breast cancer have many different treatment options. 2 of those options would include radiation therapy or surgery. Lymphedema can develop when there's damage to the lymph vessels or when they're removed, like with surgery. So women who have had mastectomies are at higher risk to develop fluid accumulation in their arm. The lymphedema is actually like a protein-rich fluid that accumulates in the arm. It can present as swelling in the arm, sometimes like a heaviness sensation, pain, discomfort, numbness, tingling, things like that can develop in the arm that's affected on the surgery. Radiation can also cause damage to the lymph vessels and can have fluid accumulation as well.
Lymph vessels, lymph nodes, are these kind of like a cleansing thing?
Yeah, a normal person has thousands of lymph nodes throughout their body.
Okay.
And they're connected by lymph vessels.
Okay.
And so fluid would drain routinely through them. You wouldn't have a problem. You wouldn't develop swelling. If for some reason that system was interrupted, the fluid would then accumulate.
See, you explain. Okay, if I understand, this is where I put myself in this position. If you can allow me to understand it, then chances are 99% of our listeners can understand it. So that all makes sense. And what happens is, during cancer treatments, like, the chemotherapy, that can clog up the vessels.
Not chemotherapy per se, but radiation or surgery.
Okay.
So if there's like a physical manipulation with surgery or something like that where lymph vessels are removed, that would impair the drainage.
Okay.
Or sometimes with radiation that can damage the lymph vessels and fluid wouldn't be able to drain properly.
All right. Then when you have these problems with the lymph, is this where the therapy comes into play? Because can anything be done medically or surgically to help these get back to normal?
In the past, we had referred women for lymphedema therapy when they had already developed lymphedema.
Okay.
One of the things that we really were attracted to CPRS for is that they want to see women before they develop lymphedema and do education and prevention, which is a unique thing that Karen can offer patients.
All right. Now let's go back to you, Karen. So in other words, again, the patient develops breast cancer, there's surgery or something, problems. Before the problems start, they consult you and the folks at CPRS. And what can you do with the therapy to help them avoid any of the problems?
Right. There's prevention techniques that we can teach patients, such as staying out of sunburn. They've already received some information from their physicians about not getting blood pressures and blood taken from that arm, any kind of thing that might encourage inflammation in that arm that maybe their body can't handle after the surgery. So there's some prevention techniques that we can do. We can also do a lot of monitoring. So what I do if patients come into me and they've had the surgery or going to is actually take measurements of both of their arms to make a comparison either from one side to the other or for future measurements of the volume of their arm. So we can really find small, almost imperceptible to the eye changes in limb volume. And if we can see a change, then we can begin treatment very early. Treatments can include wearing a sleeve or a glove to help keep the swelling down. And sometimes if they just do that, then eventually their arm may come to normal if we can catch it early enough, or we might have to initiate some further treatment if they come into us already experiencing lymphedema, or if it's someone that had surgery 10 years ago and they come into us with swelling.
All right. So it's kind of like twofold, but basically what, Melanie and her staff at the Lancaster Hematology and Oncology Center, you kind of like meet with these patients. You're saying, okay, this could be something that could affect you down the road. Let's try to avoid it in the head time. But at the same time, you may have had this done, you may have had surgery, and may have developed these problems. The physical therapy can help both ways, to prevent it and also to help it when you're undergoing it.
Right. Yeah. We try to manage any swelling that is occurring. Unfortunately, that's a lifelong management for patients who have already developed it. But we want to try to either prevent them from developing that or other problems. Sometimes patients, even outside of the lymphedema, that we're trying to help out is if they're going to be getting surgery or had surgery recently. Some women have shoulder strength and motion problems after surgery, either because they self-immobilize, don't use their arm as much, or because of radiation side effects. So that's another part of the treatment effects that we're trying to prevent from happening.
So chances are, if you are undergoing breast cancer or breast cancer surgery, it's always going to be in the arm? Could it be in the arm or just in the leg? I mean, the lymphedema problems. So in other words, are you going to notice your problems in your arms?
Correct. Yes. If you're having breast cancer surgery.
Okay.
Yeah. The swelling would be in your arm or your trunk. Sometimes, or if the patient has had some lymph node, surgery or other treatment, sometimes in the breast itself, if it was a breast saving procedure.
All right. So as we take a break, before we take a break, what would you like to say to our listeners out there? There are people out there who are diagnosed with breast cancer, going through cancer surgery. What would you like them to know?
I'd like them to know that, those side effects that they may experience are treatable, things like fatigue, pain, difficulty moving their arm or just kind of getting around, or if they have swelling, that's something that they can treat. And if it's somebody that's listening that doesn't have breast cancer but isn't facing other oncology related problems, that there are things we can do for those same types of problems with physical therapy.
All right, Karen Gallo, she is a certified lymphedema therapist with CPRS Physical Therapy. Also, Melanie Rice, who is with the Lancaster Hematology Oncology Center. Learn more about all of this and how you can get in touch with these folks. Go to the website. It's cprsweb.com. And then what you do is you click on locations and click on Lancaster, their location. And Karen is based out of the Lidditz office. So if you go to Lancaster County Lidditz, it'll take you right there. Or else you can call CPRS, and I'm sure they'll put you in the right direction of the folks you need to talk to. Of course, all the contact information, hear this interview again on our website at WHP580.com. Click on air, then Michael Parks. We will continue in a bit. We are taking care of business on Saturday mornings on WHP. Taking care of business Saturday mornings, WHP 580, Michael Parks, along with the folks from CPRS Physical Therapy, Francesca Kirk, also Karen Gallo, who is a certified lymphedema therapist, also Melanie Rice, who is a nurse practitioner with the Lancaster Hematology Oncology Center. Today we're talking about cancer, breast cancer, blood disease, and the role that physical therapy plays in all of this, how it can help you when you're diagnosed, even after and down the road. Karen, let's talk about some, it's the fear of the unknown for a lot of folks who come to and they hear about this physical therapy. They have no idea what to expect when they get there. So in other words, what goes on when they come to see you?
Sure. If a patient comes in and they're just concerned, boy, my arm feels heavy after I've had this surgery and it feels a little bit of swollen. Like I said before, I'll take measurements, so pretty painless in that respect, and truly look at their limb volume and to see if there's a real difference in the volume of their arm. If they do looking like they do have lymphedema, that they are having swelling, or if they're coming in and saying, yes, definitely my arm is swollen, besides for the assessment, what I do is called complete decongestive therapy. The components of that being manual lymph drainage. Some people like to liken to it massage, but it is very much lighter than that, to help reroute some of the fluid to the healthier lymph nodes in the body, to try to increase the speed that lymph system works to try to remove some of the fluid. That's followed up by compression bandaging. So it's a multi-layer bandage that I apply to the patient, and often teach the patients how to apply themselves if they're able to help prevent the reaccumulation of fluid. We do that several times a week for a few weeks. Really depends on how bad the swelling is and how well the patient responds to the treatment. And they wear that every day. And then once their arm gets down to a certain point, and is kind of no longer going down or similar to the other arm, we fit with a compression garment, a sleeve, and a glove usually to help keep that swelling down, and teach the patients how to do some of that light massage, manual lymph drainage themselves, to help prevent that accumulation of fluid.
And you mentioned probably normal range 4 to 6 weeks of therapy?
Probably, especially if someone already has lymphedema, they've been dealing with the swelling for a period of time. Again, someone is coming in and they're just concerned about how to prevent it, then, maybe only a few sessions.
Melanie, and again, your job, it never ends, because it's good to know that you and your staff are always there for these people no matter what.
That's right. We follow patients after they're done with chemotherapy, radiation, or surgery, or whatever the case may be for different types of cancer other than breast cancer. We follow them regularly. Right after their therapy is done, we follow them more closely, maybe every month or 3 months or 6 months. And the farther they get out from their diagnosis, the more we spread those visits out. But we do follow people throughout a lifetime. And we like to offer comprehensive survivorship care. We like to provide lots of education for patients, reasons why they would need to call us back or come in sooner for visits. Karen does a lot of education with patients in terms of lymphedema. And so when we see patients, they report those symptoms to us. We often will refer back to lymphedema therapy for additional follow-up.
Is it just people with breast cancer? Is it any kind of cancer can develop lymphedema problems?
There are other cancers that can affect the swelling in the legs as well, probably less frequent than the upper extremity. Lymphedema can occur in the legs as well, which is something I treat. Sometimes that's cancer-related, sometimes that's not. Sometimes it's due to chronic infections or other chronic swelling that patients continue to have swelling in their legs. So that's treated actually very similarly to the arm. So sometimes patients can have that too. There's also head and neck cancers that can affect swelling in the neck and face that can be treated with similar techniques.
I think it's just wonderful and fabulous, and thanks to the folks at CPRS, Francesca, for you guys to come in and actually promote and let people be aware of all this, that this is available to us, especially with the folks that, Melanie, I'm just totally learning a lot of this stuff, didn't know. But we always say, about how we are blessed here in central Pennsylvania to have these resources, these staff, the technology, the equipment, and the people are here because back in the day you had to travel so much out of the region. And, as we told the folks with CPRS, it's so nice when you're here, be going to someplace around your home where you can be treated instead of driving 2-3 hours to receive treatment. So you receive that treatment right here in central Pennsylvania in the region at CPRS Physical Therapy. Their website is cprsweb.com. Melanie Rice with the Lancaster Hematology Oncology Center. They have a website coming up very, very soon. But again, you can contact them and find out more about them through the CPRS website. Click on locations, Lancaster, Lidditz, and it'll take you right there, or else call CPRS. Check them out on Facebook and also Twitter, and they keep you guys all informed. They have some great things through the Facebook account. Keep you updated on all the news and information that's available out there to you. So, ladies, thanks so much for coming in today.
Thank you.
All right. We're going to take a break for news and information. Medical Matters is coming up next, followed by the Plant Doctor, and I will talk with you next Saturday morning at 7. I'm Michael Parks, and we are taking care of business on Saturday mornings on WHP.